Bonjour à tous, bienvenue à la conférence
Hello, everyone. Welcome to today's press conference.
States Press Conference. Monsieur Duclos, la parole est à
Mr. Duclos, you have the floor. Hello, everyone.
Good afternoon, everyone, depending on where you are in Canada. Thank you for joining us. I am in the company today of Minister Algabra, who is Minister of Transport, Minister Blair, Minister of Public Safety and Emergency Preparedness, Minister Aidu, Minister of Health, Dr. Teresa Tam, who is Canada's Chief Public Health Officer, and Dr. New, who is Canada's Deputy Chief Public Health Officer, each of those colleagues will speak in a moment. Before I turn to them, let me summarize briefly what the Prime Minister said just a few moments earlier. Tout d'abord, il a rappelé que le plan
First of all, he reminded us that the vaccine plan for Canadians is going ahead. There should be 6 million doses received by the end of March, and the target of vaccinating every Canadian by the end of September as well. More than 1.1 billion, rather 1 million doses of vaccine have been delivered to provinces and territories. In Quebec in recent weeks, we have been able to vaccinate all residents in long-term care homes, as well as a good proportion of frontline healthcare workers. He also reminded us that we, and he in particular, are in regular contact with the CEOs of vaccine providers, vaccine makers, that is. And we are actively working with the 3 other vaccine companies whose vaccines are being studied by Health Canada. He mentioned the job losses in retail sales, in the retail sales sector, which was a number published by Statistics Canada this week. He mentioned the support that's available, job support, business support for Quebecers and Canadians who need this to be able to get by. These job losses, of course, would be even worse without the wage subsidy that not only helps maintain jobs, but helps us get through this crisis once the health situation is better.
Turn happily to Minister Algabra, Minister of Transport, for his remarks.
Thank you very much, Minister Duclos. Hello, everyone. Over the past year, Transport Canada has been working alongside the Public Health Agency of Canada, industry, and other health experts to put in place a robust, layered system of measures to protect Canadians, including those working in transportation and in shipping, and those who must travel for essential purposes. Our goal is to reduce further introduction and spread of COVID-19 and new variants of the various into Canada, and to keep essential goods and our economy moving. The measures we bring forward are always informed by the latest science and data and the guidance of public health agencies. In the aviation sector, these measures have included mandatory face covering, health checks, temperature screening, and restrictions on international travel, including fewer Canadian airports receiving international passenger flights. Last month, new pre-departure testing requirements for all came into effect. Now, all travelers must show a negative COVID-19 test result taken within 72 hours of their flights to Canada. These measures are working. Overnight boarding to Canada due to not being able to show a negative COVID test or refusing elevated temperatures. The positivity rate of international travelers is low, approximately 1 to 2%. However, each new case of COVID-19 is one too many. That's why since March of last year, we've enforced some of the world's strictest border measures and restrictions on non-essential travel. By traveling for non-essential reasons, you are putting yourself, your community, and our frontline and healthcare workers at risk. As we've emphasized over and over, now is not the time for unnecessary travel. The health and safety of Canadians will always be our top priority. However, we recognize that a strong and a competitive air transport industry is vital for Canada's economic recovery. We are committed to helping the aviation sector, and we continue to work with Canada's major airlines and airports to ensure we provide the right and necessary support. What we have is a comprehensive plan. We will continue to take action whenever and wherever through targeted measures to keep goods moving, to keep our economy moving, and to protect Canadians. Thank you. And now I'll pass it on to, I think, Minister Blair.
Thank you very much, Minister Alghabra, and good afternoon, everyone. I'm very pleased to join you here today from my home, which is located in the traditional territory of the Mississauga of the New Credit. Last week, as my colleague has stated, we announced additional measures to keep Canadians safe and to help reduce non-essential travel outside of Canada. I'm very grateful for the work of Canadian Airlines, who have agreed to suspend all flights to and from Mexico and the Caribbean countries until April 30th. We are very appreciative of their support in making this very difficult decision. All other international flights are now being funneled to our 4 main airports in order to ensure that we have the proper controls in place to respond to the emerging variants and to implement our recently announced requirements. And as Mr. Alghabra has said, air travelers must now produce a valid COVID-19 molecular test before flying home, and they will soon have to take another test upon arrival at their own cost. These measures have been designed first and foremost to protect Canadians and to curb the spread of COVID-19 and its emerging variants. We also hope that it will have the effect of disincentivizing non-essential travel outside of Canada. And to that end, it's very clear that Canadians have heard the message that now is not the time to travel. And since the introduction of the new requirements of proof of a valid COVID-19 test prior to boarding, there has been an overall 46% drop in international travelers coming to Canada by air. Last week, I also noted that we will be taking additional significant measures at our land borders. And I'd like to take a moment to explain some of the complexity that we are dealing with at our land borders. As Minister Alghabra explained, we've been able to consolidate international flights to 4 main airports located in large urban centers in Montreal, Toronto, Calgary, and Edmonton. But with respect to our land borders, we are dealing with a very different environment and a more complex set of circumstances given the size of our country and the length of our border. We share a border with the United States stretching nearly 9,000 kilometers. We have 117 land border crossings, both in large point of entries and some very small and remote ones. All Canadians arriving at those points of entry, as well as permanent residents and Indigenous people, have a legal constitutional right of entry. But of course, there can be consequences for failing to comply with the requirements that we have put in place to control the spread of COVID coming across our borders. Foreign nationals who are unable to comply with those requirements are turned back. And it's also important to recognize that less than 5% of the people crossing at land border entry points across this country are coming for non-essential purposes. With close to $2 billion in trade with the United States happening each and every day, essential goods still need to be transported across that border while minimizing any slowdowns. We have done, I believe, excellent work to ensure that produce, essential goods, and our goods are able to get to market across that border and the movement of essential workers. But these challenges require that we work diligently with all of our partners, including the United States, to make sure that our land border measures will be effective. Some of the new measures that we are working on to ensure the safety of people entering our country include measures that may require all arrivals of non-essential travelers at our border to have taken a COVID test 72 hours before seeking entry. And as I've indicated, foreign nationals who do not have that test will be turned back. And at the same time, commercial truckers will remain exempt to ensure that supply chains, essential services, and support for critical infrastructure are not adversely affected. we're working hard to stand up additional testing requirements for land travel. All travelers, including those identified exempt, will still be required to wear a mask in public settings, maintain physical distancing, respect the public health guidance of the area they are traveling, and at all times comply with Public Health Agency of Canada orders for quarantine. I want to advise Canadians who are concerned about the implications of whatever new requirements we may put in place can have on their return to Canada, particularly for those Canadians who are currently in their at winter residence and have been for some time. I want to assure them that we will provide them with ample notice of all new requirements to ensure that they are able to comply. And at the same time, I want to assure them that the measures we're putting in place are for their protection and for the protection of their friends, families, and communities to keep them safe. The measures that we will implement are intended to be workable and to protect Canadians. We will examine all of the ways in which we can do that most efficiently. In the meantime, I also want to remind Canadians that the border measures that we have put in place remain among the strictest in the world. We have banned all non-essential flights to Canada. And all non-essential travelers, new quarantine conditions, so that everyone returning to Canada who is not exempt is required to go into quarantine. And I believe quarantine has been our strongest measure. No matter how you enter Canada, even if you have proof of a valid test or that you have been vaccinated in another country, the mandatory 14-day quarantine will remain in place because it is our most effective tool. Health and law enforcement officers will be in regular contact with travelers to ensure that they are following the quarantine orders. And we are working very closely with our provincial, territorial, and municipal partners to enforce all of these measures. I want to remind the vast majority of Canadians are complying with these quarantine requirements, and we are grateful and we thank them for the measures that they are willing to themselves and their communities. There are a few who are non-compliant and disregard the orders, and I would remind them that breaking quarantine is a serious act and it can result in serious consequences. The enhanced border measures is also being reinforced by enhanced presence of border services and public health officers at our borders to ensure that travelers understand all of their obligations. We will continue to support and manage supply chains on both sides of the border, and we will continue to collaborate with our partners in the United States to strengthen our border measures and doing everything that is necessary and possible to keep our communities safe. Thank you very much.
Dr. Aidu?
Thanks very much, Minister Duclos. Today, I just want to remind community organizations across the country of new available funding to help increase vaccine uptake in specific communities. This available funding is in the total amount of $30.5 million. And as we see vaccinations begin to roll out across the country, we're very focused on making sure that everybody understands the benefit of vaccination, including in communities that sometimes have more skepticism about investment. Will help ensure that communities and public health stakeholders across the country can design approaches that include education, that include information sessions, a variety of different innovative ways to reach people sometimes who are skeptics of vaccination or perhaps vaccine hesitant. We know that we are on a good path with vaccination. We anticipate that by the end of September, every Canadian who wishes to be vaccinated will have access to vaccines. And so it's very important that we continue to reach into communities that may not have the same exposure to public health messaging in ways that are culturally appropriate and relevant. And finally, on the new measures at the border, I will just say that I want to thank the hotel industry for their collaboration and their focus on this initiative. Our officials have been in touch with the Hotel Association to hear their feedback. We have committed to continuing to work with them to provide additional clarity as we move forward. And there is a new webpage for information where hotels can get information about how to participate in the quarantine process. And we'll have more to say in the days to come.
Thank you very much. Can I now turn to Dr. Tam?
Thank you, Minister Duclos. Bonjour à toutes et à tous. There have been 793,000 COVID-19 in Canada. including 20,513 deaths and less than 48,000 active cases, representing a 30% decrease in active cases across the country compared to 2 weeks ago. And over the past 7 days, there have been an average of 3,947 new cases reported daily, as case counts continue to decline and many provinces reported over 15% fewer cases compared to last week. This is definitely good news for some of the most heavily impacted areas of the country. But there is still reason for caution, as some areas saw more modest reductions or small increases in activity. Likewise, even with a steady 2-week decline, case counts are still about double what they were at the peak of the first wave. So the easing of restrictions will need to be done gradually and cautiously. As well, there is a continuing concern in Canada and internationally around more transmissible virus variants. To date, provinces have reported over 242 cases of the B117 variant, with New Brunswick and Saskatchewan reporting their first detections this week, while the number of B1351 variant remains at 13 cases. Despite the cautions we've grown accustomed to hearing with our good news, we are assured that our efforts are having an impact, and thankfully, the gradual decline in severe outcomes continues. Over the past week, the average daily number of people with COVID-19 being treated in Canadian hospitals has declined by over 10% to around 3,600, with under 740 in critical care, and fatal cases have dropped by over 15% to 121 deaths being reported each day. As each day brings us more headway against COVID-19, let's hold fast to the measures we know are working. The past weeks of our collective sacrifice has made a difference, reducing illnesses, saving our healthcare workforce, and building out a longer runway for vaccines access to expand and begin to work for all Canadians. Let's keep working together and moving forwards with our best effort. This weekend, many will be watching and rooting for their favorite Super Bowl team. Like many events and celebrations during COVID-19, we need to limit in-person contacts to our immediate household. And by connecting with others virtually, we can still enjoy the Super Bowl, but without the super spreader. Thank you.
Thank you so much, Dr. Tam. May I now turn to Dr. New?
Merci, Ministre.
Thank you, Minister Duclos. Hello, everyone. There have been 793,734 cases of COVID-19 in Canada, including 20,513 deaths and less than 48,000 active cases, representing a 30% decrease in active cases across the country compared to 2 weeks ago. Over the past 7 days, there has been an average of 3,947 new cases reported daily. Counts continue to decline, and many provinces reported over 15% fewer cases compared to last week. This is definitely good news for some of the most heavily impacted areas of the country, but there is still reason for caution, as some areas saw more modest reductions or small increases in activity. Likewise, even with a steady 2-week decline, case counts are still about double what they were at the peak of the first wave, so easing of restrictions will need to be done gradually and cautiously. As well, there is continuing concern in Canada and internationally around more transmissible virus variants. To date, provinces have reported over 242 cases of the B117 variant, with New Brunswick and Saskatchewan reporting their first detections this week, while the number of B1351 variants remains at 13 cases. Despite the cautions we've grown accustomed to hearing with our good news, we are assured that our efforts are having an impact, and thankfully, the gradual decline in severe outcomes continues. Over the past week, the average number of people with COVID-19 being treated in Canadian hospitals has declined by over 10% to around 3,600, with under 740 in critical care, and fatal cases have dropped by over 15% to 121 deaths being reported each day. As each day brings us more headway against COVID-19, let's hold fast to the measures we know. The past weeks of our collective sacrifice have made a difference, reducing illnesses, saving lives, taking pressure off our healthcare workforce, and building out a longer runway for vaccine access to expand and begin to work for all Canadians. Let's keep working together and moving forward with our best effort. This effort, many people will be watching and rooting for their favorite Super Bowl team. Like many events and celebrations during COVID-19, we need to limit in-person contacts to our immediate household. By connecting with others virtually, we can still enjoy the Super Bowl, but without the super spreader. Thank you very much.
Merci beaucoup.
Thank you very much, Dr. New. We'll be happy to take your questions now. Thank you. We'll go ahead with questions by phone. Each journalist may ask one question and one follow-up question.
For one question and one follow-up. Opérateur, première question.
Thank you. Merci. The first question is from La première question est de Rachel Haynes from CTV News. Please go ahead. À vous la parole.
Hi there, Rachel Haynes here. I just want to go back to some of the vaccine discussion that we are having. The Prime Minister spoke today about how every Canadian who wants one will be vaccinated by the end of September, and yet Minister Hajdu said that there will be enough vaccines by September to vaccinate everyone. So can you please clear this up? Is it going to be every single Canadian who wants one at the end of September will be vaccinated?
Yeah, listen, I'm sorry if I was unclear. The goal that we have is that every Canadian who wishes to be vaccinated will be able to do so by the end of September.
And is that something that you've spoken to about the provinces on how feasible the city of Ottawa? They've started talking about how their rollout, mass rollout will start at the end of August. So even if the provinces are delivered these vaccines, which at this point, you know, I'm not sure how we can trust given all the delays, have you even spoken to provinces about if they will be able to vaccinate everyone on this timeline?
Thanks, Rachel. Well, yes, in fact, the work that we've been doing through the Public Health Agency of Canada under the leadership of Major General Danny Fortin is to do that coordination with provinces and territories, first on this early stage, as you know, in the Q1 stage with Pfizer and Moderna, getting provinces and territories ready in December and, ready to receive and distribute those vaccines, including to remote communities, has been a focus of their work collaboratively. But moving forward, the planning has begun and is well underway for the second and third quarters, where we anticipate we will have a volume of a variety of vaccines available in Canada and available to be distributed by provinces and territories. So that work is ongoing at the officials level and certainly has been discussed at the ministerial level as well.
Merci, thank you. Next question, prochaine question.
Thank you, merci. The next question is from La prochaine question est de Christian Noël de Radio-Canada.
Radio-Canada, please go ahead. Question. Hi, everyone. My question is simple. You're repeating that we're going to have all the doses promised to us by March 31st. If the companies do not deliver, what can Canada do to force them to do so? Answer. Thank you very much for your question. Let me remind you quickly what the working relationship has been since the very beginning. We have an agreement with 7 different companies. We've already seen some results since December. The 2 companies we're currently working with for delivery of vaccine and administration, I mean Pfizer and Moderna, are companies that will deliver the first vaccines, that have been delivering the first vaccines to Canada. Canada was the second country to receive them. We've had very good relations with these companies for a long time. And I'll just point out that the Public Health Agency of Canada and Health Canada have an excellent reputation internationally. Let me interrupt you, Minister. You're avoiding the question, as Mr. Trudeau said. I understand that we have a good relation with these companies, that we're in contact with them, but in the contracts, are there penalties if they don't deliver on time? Answer. There's a clear target and commitment that the Prime Minister reminded us of today. We speak every day, and by the end of March, the commitment has been made to deliver 6 million doses. We've been very transparent with you and with Canadians on this. Follow-up question. Answer. Clearly, you don't have any intention of have the transparency they require. With regard to the contracts, do these contracts foresee the option of receiving other vaccines from other companies before the end of the first quarter? Answer. Excellent question. Ms. Anand has already responded. There are 1.9 million doses coming by June with the COVAX agreement, which we are all aware of by now, as well as the 20 million doses from AstraZeneca in a agreed upon in a bilateral agreement. Some of those doses could arrive by the end of March. It will depend on the independent approval method at Health Canada.
Thank you. Merci. The next question is from, la prochaine question est de Mia Robson from the Canadian Press. Please go ahead. À vous la parole.
Yeah, Dr. Tam, Dr. New, this is probably best directed at you, that although the numbers are going down and we have reason to sort of think that that's good news, that we need to sort of continue to buckle down and do what we've been doing. But I'm wondering if we know yet or have any sense yet of at what point our vaccination rate is going to allow us to lift some of at least the lockdown restrictions and sort of move to more just masking and social distancing without the stay-at-home orders. When do we have a sense of how many people have to be vaccinated before that can start to happen?
Well, as I think you can appreciate, these vaccines are pretty new, and we have different vaccines coming on board with potentially different characteristics as well. So I think what I'm trying to do is monitor the data itself. So as provinces begin to vaccinate, to determine what the vaccine effectiveness has been. So there are essentially evaluations or vaccine effectiveness surveillance that are at play. So that's really important so that we can judge how these vaccines perform in the context of the Canadian population in the field. And Canada is a vast country as well, so we would ideally like to see that data from across the country. One of the first pieces of data we'll be looking for, of course, is the impact on the long-term care facilities, the seniors, and see if that has any impact on hospitalizations and on deaths. So that'll be one of the first indicators. But because we do not know if the vaccines are good at reducing transmission of the virus or asymptomatic infection, it is actually really difficult to say what point that would be. But I do think that, we just have to keep week by week monitoring as vaccines roll out what that real-time impact is. And I will be looking towards the United Kingdom and Israel and other countries for some of those signs as well. And then our modelers are also hard at work right now trying to input these evolving parameters into a model together with the public health measures to see if they can give us some forecasting. But right now, it's a matter of just watch the space, and hopefully we'll be able to provide some more of that information in the near future.
Okay, I guess that sort of answers my follow up a little bit in terms of when that would happen. But the other question I have is, I don't know if it's for you or for maybe Minister Hajdu, in terms of vaccine hesitancy, what data have we tried to collect on how much hesitancy exists, what is causing that, and if it's different things, are there different things that are causing people to be afraid of the vaccine depending on where you live or your background? What data do we have on that specifically?
We can't hear you, Minister.
Well, thanks, Dr. Tam. I'm saying in response that I'll just generally say that we do actually track data on appetite for vaccination, not just in terms of the new COVID vaccination, but certainly influenza vaccination and other vaccination across the country. And that's an ongoing process that the Public Health Agency of Canada is involved in. And then there are a variety of different reasons why people might be hesitant. But I will turn to Dr. Tam because she works extensively with NACI and others on this very issue.
Yes, and there's a number of surveys and tools that's been tracking the Canadian population in terms of their intention to get the vaccine and the underlying reasons for why they would or would not. Some of the studies are actually carried out by the Privy Council office, where there is a behavioral insight team. We do know that the intention for Canadians to get the vaccine is actually quite high, and I think has improved since we started the vaccine campaign itself. And the majority, I would say, I think is now over 70% of people do intend to get the vaccine, but there's a proportion of these that don't want to get it straight away. Of course, they're straight away anyways, but when they get their turn, they should be lining up for the vaccine. And I think there's a number of different perspectives. One is that there's a number of people who just have basic questions about the vaccine, in terms of clarifying that the rapid development of the vaccine does not mean we've compromised safety or effectiveness. Those are some of the really key questions. People have questions about the new technology, etc. So we've been trying to answer those. There are, of course, there's actually interesting piece of data that indicates that people who get the information from social media and from peers and different sort of Facebook groups, etc., are more likely to be vaccine hesitant. So I think whereas people who may get their information from mainstream media or from other credible internet sites are less likely to be vaccine hesitant. So for that, we know then we have to work with the internet and social media companies. And that has been happening with Facebook, Google, YouTube, and others to direct people to the correct information. Another aspect is healthcare workers. There's some statistics showing that some healthcare workers still have questions about the vaccine, and that they not all of them have made up their minds to take it. And so we've been working with health professional organizations in order to help the education and the provision of information to healthcare providers. The latter is really important because, in fact, the Canadian public look towards the healthcare providers to get that reassurance, and their vaccine confidence are boosted if we enable our healthcare workers to provide information to them. But we do have behavioral insight that also shows that if we enable key influences on social media, and I just interacted with a very big group of religious leaders, for example, then we can boost that vaccine. Monitoring that really carefully. There's about probably 10% of people who just says we are not going to get the vaccine. 10 to 12%. Others we can absolutely work with, Look at our seniors. They're getting vaccinated. The vaccine so far has been safe with no safety signals. So I think that's actually a really good way of boosting vaccine confidence, is seeing other people get vaccinated.
Merci. Thank you. Next question. Prochaine question.
Thank you. Merci. The next question is from, la prochaine question est de l'INADIB de la presse canadienne. Please go ahead.
The Canadian Press, go ahead.
Rabra or Minister Blair, I was listening, I think, well to what you had to say about these measures for traveling people, and I didn't hear anything different from what was said last Friday, and still no date for when these new measures are going to be implemented. So do you have a date? Do we know at what point those PCR tests are going to be administered in airport for every traveler, and who will have to go to that hotel and stay there for 3 days and pay $2,000? And if you don't have a date, could you explain to me what's the holdup?
Bonjour à tous. Nous avons présentement des problèmes techniques.
We're currently experiencing technical difficulties. The image no longer is being broadcast. We'll be back as soon as possible. Answer, yes, I'm here. But there's not really any point. You say there's only the 2 doctors left? Yes. All right, well, I don't think you can answer my question.